Welcome back. Sunday marked 30 years since the first cases of AIDS were reported in the U.S. About 34 million people around the world are infected with HIV, the virus that causes AIDS. 1 million of them live here in the U.S. Reported cases of AIDS has gone down overall, but the San Ysidro Health Center says that is not always the case among other groups. Dr. Greg Talavera is with the San Ysidro Health Center. He joins us now. Nice to have you here.
Thank you, Mark.
Which groups are not getting the message? Who's still being disproportionately affected?
Yeah. Well, in terms of the AIDS epidemic, the disparities really lie with our ethnic minorities. The African American and Hispanic community are largely overrepresented in the statistics right now.
Why?
It's multifactorial. Part of it is due to poverty. Part of it is due to access to care, and certainly early diagnosis is key to treatment and control of this epidemic in those communities.
What's interesting is you look at some of the statistics which are out, saying that the annual AIDS cases rate among blacks is about 3 times than what is seen in whites. Hispanics have the second highest number of cases, and that the proportion of Hispanics with less than a year between HIV and the actual AIDS diagnosis has increased significantly over the last 15 years. Increased. Why? What gives?
Well, it's part of the economic situation we have in the United States. Access to care is key. Having a medical home is key. Without early diagnosis and without someone approaching you about the possibility of being screened, it just gets delayed, and we have late diagnosis, and then you see the statistics that you're just reporting there.
And whose responsibility is it then? Is it up to the patient to go and request a screening, or should health providers be more vigilant in reaching out?
Well, it's really a public health issue at this point in time. It's everybody's responsibility. We really need to get the message out. We need to address issues of stigma. We need to address issues of access to care, and we need to promote early screening. In fact, at San Ysidro Health Center, we're about to embark on a new strategy. We are going to make HIV/AIDS testing routine as getting a cholesterol. We're not even going to, historically we have asked people if they wanted the test. Historically we have targeted high-risk populations, but now with the statistics as they are, we feel that it's important for everyone to get screened because so many people don't realize that they've been infected through their activities.
And with all due respect, this seems like a great idea. What took so long?
It takes money. It takes extra staff. It takes someone to coordinate that. It takes more staff to contact the people once the results come back in, and fortunately the federal government is offering support in that area. We've been trying to do it as best we can, but healthcare dollars are tight, and there's a lot of other health conditions that we're dealing with too. So,
I was in San Francisco, working there and living there during the 1980s. Bathhouses getting closed down. Drugs just not widely available, and we saw so many developments. Can you talk a little bit about, with all of the medical progress, with people identifying, say, someone like a Magic Johnson doing so well, do you think that a lot of people these days think that they are bulletproof, or in fact, if they do contract HIV, that they'll be just fine, that there's not the urgency there once was?
Yeah, I think that there is some of that now. We do see that the number of deaths from AIDS is decreasing or stabilizing, and the number of people that are living longer periods of time with it. So I think that does create a false sense of security. But there are also vulnerable populations that don't know that maybe their sexual partner is engaging in the risk behaviors that lead to AIDS when they themselves feel that they are safe because they're not engaging in those. So that's another population that we're trying to reach out to and get them to be screened, to educate them about the risk factors for AIDS.
Okay, so let's say now the federal government makes available to you all extra money so that you can do the screening. How do you now battle the stigma for when you have a client who comes into your office for some routine test to convince them, hey, let's test you for HIV as well?
Well, that's part of our public health strategy. We are going to have flyers in the clinics. We are going to announce to patients as part of, all our staff will be promoting that message that we are going to be screening everyone. And we will just...
Not even electively. It's like if you come in just for routine blood. I mean, I just had a physical done, and it wasn't even a question. And so the doctor, I test for HIV, whatever, and it's no big deal.
We're going to make it routine. We're going to desensitize people around the issue. But that's part of the role and expertise of San Ysidro Health Center. We know how to do that in a culturally sensitive fashion. We know how to deal with minority populations and vulnerable populations.
What do you say? What if you have somebody who comes in, Hispanic or African American? What's the pitch to them to get this done? What do you say?
Well, we're going to say much what I've been telling you, that the AIDS epidemic is still very prevalent in our minority communities, and that everybody should be screened. It's not a reflection of you, but just the reality that everyone is at risk. I think those are the key messages that we're going to promote. And we're going to be telling everyone that. They'll see signs. Our front desk staff, our medical assistants, and our physicians will be repeating the message. So hopefully it will convince them that getting the test is not a sign that they are doing anything wrong, but that they're really just vulnerable, and we want to know.
Okay. You guys can handle that. And for people who are a little bit more proactive and wanting to do it, you guys have an event, and we'll put some of the information on the screen right now. This will be National HIV Testing Day, which you all will be taking part, which will be Monday, June 27th, 10 a.m. to 2 o'clock in the afternoon at the Health Center, which is located at 2909 Coronado Avenue in San Diego, and it's free.
Correct. And one correction, it's actually at the Northgate store.
Oh, is that it?
Close to the clinic.
Okay, and what is the address there? Do you recall
That's
it?
the address.
It is.
It is, but it's not the health center. It's actually a Northgate shopping mall,
okay,
where a lot of Hispanics and other minority populations shop, so we're going to where the people are.
Okay. Well done, huh? Thank you very much.
Thank you.
We appreciate you coming in and talking about all of this. And it still seems encouraging. I mean, are you excited about this sort of next chapter?
Yeah, I think this is the next stage in controlling the AIDS epidemic, is early diagnosis and early treatment and access to care. Those are key public health messages we want to get out to everyone.
Terrific. Dr. Greg Talavera, thanks very much.